So today I want to talk about weight loss and some of the tools that we have to manage weight management and weight loss. The basics are actually very simple. We have to keep a negative calorie balance, so what the body is burning and what we're consuming, in order to be able to achieve an ideal weight loss program, which is not too fast and not too slow. It has to be accompanied by physical activity. The physical activity, we like to divide that into cardio and non-cardio, with more of the weight and resistance training. Now, if someone was very low on their muscle mass, then we push the weights a little bit. If someone needs to lose a lot of body fat, then we go towards the cardio more often, and that gives a good result. But I like to keep the heart rate during exercise at around 130. That seems to be zone 2, the magic number for mitochondrial activation and good long-term results. As far as tools for weight loss, I have many tools that we do deploy readily at the practice. I use phentermine, 37.5 milligrams, usually 1 pill per day for the management of appetite. On top of that, I add the class of GLP-1 medications. The GLP-1 medications are going to revolutionize the weight loss, and they're really going to basically allow for people to lose body fat at a strong rate. The trick is that all of us that are living in the 21st century, our ancestors had to survive conditions of famine, of war, of hunger, and in those conditions, the people survived that were able to put on the most amount of weight, who would maintain their weight and not lose their weight. So what the bodies have accustomed to, and people that have survived, that gene predominates, are basically the people that can keep their weight and not lose it easily. So the GLP-1s actually basically allow us to cut the appetite, affect the brain, slow the metabolism, and enhance the metabolism, and give a sustained weight loss. And that is really very effective. It's usually in the form of once a week injection, and from a GLP class medication, for example, like semaglutide. It works very well, and the results are phenomenal. The trick is also to make sure that meanwhile, there's no B12 deficiency, no thyroid deficiency, no vitamin D deficiency. The exercise is on a routine basis, and with some very advanced tools that we have at our disposal in the practice to begin to identify like what percent of fat does the body have. I saw a lady yesterday, she's like maybe 105 pounds, but high body fat percentage. And the next patient after her was a man who has a strong history of diabetes, but the muscle mass is really good, but the cholesterol is a mess. So at that point, then you have to begin to figure out what every person needs. And so we try to make our approach from a general term very individualized to that particular individual. And that is why we've been very successful in managing weight and not having people go through kind of a yo-yo weight loss program.